Imagine a patient suddenly becomes pale, cold, confused. Blood pressure starts falling, and within a minute, organs begin shutting down. What exactly is happening inside the body? This dangerous condition is called shock. And hello everyone, welcome back to the channel. In today's video, we will discuss shock in a simple and exam oriented way, including definition of shock, types of shock, its pathophysiology, stages, and we will understand compensation, recognize clinical feature and outline its management. So, shock. What is shock? Shock is a state of acute circulatory failure in which there is inadequate tissue perfusion, leading to insufficient delivery of oxygen and nutrient to meet cellular metabolic demand. So, it is a condition in which circulatory failure होगा जिसकी वजह से inadequate tissue perfusion होगा, टिश्यू में inadequate blood supply होगा, that leads to insufficient delivery of oxygen and nutrient, जिसकी वजह से सेल्यूलर मेटाबॉलिक डिमांड मीट नहीं हो पाएगी और एक स्टेट होगा जिसको हम लोग शॉक बोलेंगे. सो व्हाट हैपन्स हियर, देयर इज़ अ मिसमैच बिटवीन ऑक्सीजन सप्लाई एंड डिमांड बिकॉज ब्लड टिश्यू में उतना आ ही नहीं पा रहा है, टिश्यू परफ्यूजन हो रहा है. सो इट इज़ अ लाइफ थ्रेटनिंग कंडीशन. It leads to cellular hypoxia and organ dysfunction. Now, types of shock. There are four major types of shock: hypovolemic shock, cardiogenic shock, distributive shock, and obstructive shock. So, hypovolemic shock. It is caused by severe decrease in circulatory body fluids or blood volume. In simple language, we say when the body loses too much blood or fluids, the heart cannot pump enough blood to organs that lead to hypovolemic shock. Now, causes of hypovolemic shock. It occurs due to hemorrhage, burns, dehydration, vomiting, diarrhea, or diuretic overdose. Our body needs adequate blood supply, blood volume to maintain blood pressure and tissue perfusion. When volume decreases, it results in decreased venous return, cardiac output decreases, blood pressure falls, organs receive less oxygen, cells start dying due to hypoxia, and this ultimately leads to shock. Cardiogenic shock. Cardiogenic shock is a type of shock caused by failure of heart pump. Definition: cardiogenic shock is a state in which heart fails to pump enough blood to meet body's need. In hypovolemic shock, we saw it occurs due to decreased blood volume. In cardiogenic shock, it occurs due to pump failure. In cardiogenic shock, blood volume may be normal, but the heart muscles becomes too weak to pump properly. As a result, cardiac output decreases despite normal blood volume. Blood pressure falls, tissue perfusion occurs, and organ receives less oxygen. Now, common causes: myocardial infarction, heart failure, severe arrhythmias, or valves disorder. Maybe severe mitral regurgitation or aortic stenosis. What if the body has enough blood, the heart is pumping properly, but still the organs are not getting enough blood supply? This happens because of the blood vessels becomes excessively dilated, causing blood pressure to fall dangerously low. This condition is called distributive shock. Now, types of distributive shock: septic shock, anaphylactic shock, neurogenic shock. Septic shock, it is most common. It occurs due to severe infection. Example: gram-negative bacteria, usually caused by bacteria, fungi, severe systematic infection. So what happens here? Infection triggers inflammatory mediators causing massive vasodilation increased capillary permeability and leakage of fluid from vessels that results in vasodilation and decrease in effective tissue perfusion. Now, anaphylactic shock. It occurs due to a severe allergic reaction, may be caused by drugs, insect sting, food, and it also leads to vasodilation, increased capillary permeability, and decreased blood pressure. Coming to neurogenic shock, it occurs due to loss of nerve supply. Example, spinal cord injury. If spinal cord injury occurs, that leads to loss of nerve supply that results in vasodilation, blood vessels dilate, and heart rate may slow down. Blood pressure decreases, bradycardia occurs. Now, obstructive shock. It, by the name, we can say that it occurs due to any obstruction to blood flow. So, it is a type of shock where blood flow is blocked due to physical obstruction, preventing the heart from effectively pumping to the body, even though heart itself may be functioning normally. What happens here? In obstructive shock, sometimes mechanically interfere with circulation. Something mechanically interferes with circulation. This leads to decreased cardiac output due to obstruction in blood flow, decreased oxygen delivery to tissue, and increased risk of organ failure. It may be caused due to pulmonary embolism, cardiac tamponade, tension pneumothorax, and constrictive pericarditis.
I will be covering stages, clinical features, and its management in next video. So stay tuned, like and subscribe.